You are about to see an incredible transformation here on our member profile segment. With us is Dr. Andrew Moffitt from Moffitt Restorative Dentistry in Champlin. Doc, welcome back to the show. It's been a while since we've seen you. Thanks for coming back.
Thank you, Pete.
First, let's talk about Moffitt Restorative Dentistry. Where are you located?
We are here in Champlin, right across from the Mill Pond, just right down the road before 169 turns towards Anoka.
All right. Tell everybody out there what type of dentistry you specialize in.
I'm a prosthodontist, and a prosthodontist is someone who specializes in replacing lost and broken teeth. Basically, that's what it is.
That's simple. And say that word again.
Prosthodontist.
Prosthodontist. Now, practice at home, because I had to ask him before he said it. Let's dig into that a little bit. Talk me through what an implant denture situation deals with.
Very good. An implant denture, or a denture that's supported by dental implants, is one where someone may not have teeth and implants are placed underneath the gum tissue, and a denture would support those, or those implants would support the denture, and it increases patients' stability, retention, and people are able to chew and have much better nutrition as well.
You know, I mean, I grew up and Grandma had the dentures, and I remember it was always, you know, the cream stuff. And tell me what's different about an implant denture from, say, just a conventional denture.
The conventional dentures are ones that rest on top of the gum tissue, whereas an implant-supported denture, the denture is either, it snaps into the implants, or in Karen's case, the denture is screwed into the dental implants. So it makes it so that it's so much more retentive, and there's so much more support as well.
Now, do you make all types of dentures?
We certainly do. We make the conventional dentures, those that are removable, the ones that are fixed in place, as well as those people who have teeth. We are able to restore their mouths with crowns, fillings, implants. It's a wonderful transformation.
You know, I had a chance to see some before and after pictures that we've got here that Dr. Moffitt brought with him, and Karen's the patient in those, and to see the transformations occur, and you'll be seeing those on your screen from step one to the end, and Karen was gracious enough to come today. Talk to me a little bit about how the treatment provided by Dr. Moffitt at Moffitt Restorative Dentistry benefited you.
Well, for me, I've been wearing dentures for many, many years, and I had gotten to the point where they were in very poor condition. I was in constant pain, especially when I tried to eat. I had to have all my food ground, so I couldn't eat regular food. If I went out, I had to have soup because it was the only thing that I could have. And the dentures had sunk so low that even my face had started to cave in and deform.
Wow.
And I couldn't speak very well. I couldn't enunciate or pronounce my words at all. So I went to Dr. Moffitt for help.
All right, so you walk in, he's telling you, oh, Karen, no problem. We can take care of you. We can get it all done, but still, it's you. You're going through some issues that are really life-changing for you. I mean, you talk about what you went through. Were you nervous when you started the treatment?
I was extremely apprehensive.
I bet you were. I bet you were.
I've spent many, many years of going to dentists and having painful visits and having just pain every single day. And I didn't know what he could do to help me. I was sure he could help me. I just didn't know how. So even just walking into the office, the old anxiety comes in, but Dr. Moffitt and his staff would calm me down and help me get through everything. They would explain everything in great detail, so I always understood what was going to happen. And then even if it got the best of me and I got a little nervous, they would just kind of pat my hand and help me to get through anything, so I felt more comfortable.
Now, I can tell just from your smile, because the question that I'm going to ask you is are you satisfied with the results? And yes, you are, aren't you?
Yes, I am.
Yeah.
It's been a huge transformation for me. I don't have pain anymore. The constant pain is gone. I can chew any food that you can chew, any normal food at all. My face, he was able to make it look more normal, so it's not all caved in. It's more back to what it used to be before all those years. And I'm able to speak well, which in my work is essential. So now I'm much more productive in my job because I can speak to people and they can understand my words.
You bet. Dr. Moffitt, you got to feel good about sitting in that chair, doing what you did for her and what you do for so many other people.
Yes, sir.
Yep.
Very much so. It's very rewarding.
And I know that you have all had a chance to see those befores and those afters. Karen, I'm so happy that you were able to hook up with Dr. Moffitt and make this life-changing appointment that really sets you back onto the track. And now you can go to Two Scoops and you can have that hard cone candy, cotton candy ice cream cone if you want it, can't you?
I can.
That's what we're talking about. All right, Dr. Moffitt, Moffitt Restorative Dentistry in Champlin. Somebody out there is watching this, and I know that there's somebody out there going, wow, I didn't know that I could get help, that this could be better. How do they get a hold of you and find out more?
We are located on the web at www.moffittrestorativedentistry.com, as well as you can call us at 763-427-1311.
Dr. Andrew Moffitt and Karen Heck, who is a shining example of what they do at Moffitt Restorative Dentistry. Thank you both so much for coming here today.
Thank you.
Pete.
Thank you.
Appreciate it.